Hello.
Hi there.
Is it Mrs. Sultan?
That's right, hello.
Hi, how are you?
Well, I'm a bit, it's been through a lot recently, and I feel, certain things happened that I think could have been better in my labour.
Right,
Yeah.
okay. So let me just introduce myself.
Yeah.
My
Hi.
name is Dr. Dia Prawesti.
Hello.
I'm one of the registrar. So I know you've been through a lot
Yeah.
in your labour.
Yes.
And my purpose today here is just to talk you through all the process of your labour,
Yeah.
and if and then I'll try my best to address your concern.
Yeah,
and
good.
I would definitely agree with you. There's probably a few things that we probably could have done it better.
Okay.
Is that okay?
Yeah, please.
So have you got any concern?
I just worry that I don't know, so many things. Basically, at the end, my son has ended up in a special care unit, and I just feel things could have been spotted earlier, and we didn't have to get to that point.
So let me just go back through your pregnancy and delivery, if you wouldn't mind.
That's okay.
So you had normal
everything was
pregnancy.
absolutely fine.
Everything was fine. May I just ask, did you have a glucose tolerance test at all during the pregnancy? The one when you had that very sweet drink. No, you didn't have.
I had
that.
the urine was tested.
Just dipstick. Okay, but you didn't have any glucose tolerance test. Okay, that's fine. So and then you came in labour.
That's right.
And
yes.
it was like spontaneous labour.
Well, it was. It just
Yeah.
went on. It's slow, and I had an epidural, and it was just taking a long time to get to a certain level.
Right. So may I just ask, did you have any scan apart from your dating scan and your 20 weeks anomaly scan? Was there any
Only
other
two
scan?
scans, yeah.
Only two scans.
Yeah.
Okay.
That's what gets me. They kept saying that I had a big baby. He was nearly 11 pounds, 5.2 kilograms.
Yeah.
And why didn't someone spot that I going to have a big baby? I mean, I know I'm quite tall and everything, and it wouldn't have been an issue, but for me, I would be more prepared.
Of course.
And then the midwife said that Joshua, was back to back.
Back to back, yeah.
So being back to back and having a big baby and it being really slow, I would have thought
it should be raise a concern.
Yeah,
yes,
early on I just
agree.
felt.
Yeah, of course. So yeah, I think obviously we're going to look at the care that we gave to you throughout your pregnancy as well as delivery.
Yes.
So I can reassure you that we are looking at it at the
Good,
moment, so
yes.
that we can identify what sort of improvement that we can do, especially with your future pregnancy, and obviously so that we can improve our care to other women as well.
Well, the thing was that I was with the midwife and everything was okay, and then they said but the baby had turned and the baby had pooed, and then she did the heart rate thing, she was very concerned, and she was trying to get hold of a doctor, and I had, we had to wait nearly 20 minutes to half an hour before somebody came and examined me. And once that person had examined me and tested me and talked to me, I went straight and had an emergency cesarean, and I just felt that was a bit odd, waiting that time, and then could he have been in a better state if if we'd just gone for a cesarean in the first place? If someone said I got a big baby, the position was wrong, I would have just gone for a cesarean maybe, and not convinced myself I could have a natural birth. I don't know. Yeah,
it's probably, as you rightly mentioned, that it's probably was going to be a bit different if we would have known that actually the baby is really more than 4.5 kilograms.
I mean, I was being measured every week, every 4 weeks
every year
with my antenatal. You'd have thought, they would have noticed. I mean,
well, that's a bit difficult thing, isn't it? Because obviously the measurement, although it is a very, very good tool to try to predict the size of the baby, is not as accurate either. So yes, that's absolutely true, that if it is, if we would have known before, then something would have done a bit differently.
Right. Okay.
So probably the other thing is that I probably would mention, just for your future reference with regards to your future pregnancy,
Yeah.
that we would probably advise you to go for glucose tolerance test. Okay.
Right. So you think there was something wrong with my sugar level and that affect the baby?
So basically, sometimes that is the reason why you actually have big baby, because you probably was diabetic in this pregnancy, which is again very common.
But wouldn't the antenatal midwives pick that up? Why didn't they pick that up?
So normally we don't offer this test to every woman.
Oh, okay.
Okay. So we do go by like risk assessment of someone who might develop diabetes in pregnancy.
Right.
I had a look on your notes that you have had some sugar leaking from the kidney. On your urine dips test. Now, sometimes
when was that done then? In hospital?
I think it was when you came.
Oh,
so,
yes.
Yeah, but throughout the pregnancy, there was nothing indicates that you might actually develop diabetes in pregnancy. But obviously, because we know now that your baby is on the bigger side, then I think it is sensible for us to do it in the next pregnancy as well. And then what we can do, we can also check your bloods in about 6 weeks after the delivery. If you were to have diabetes, then if it's still persistent there, then obviously we can manage that accordingly as well.
Right.
Okay. So that's sort of, things that probably could have done better. But again, I would say that during the delivery, I do apologize for the delays and everything. We will definitely look into that.
Yeah, I would hate that to happen to somebody else. I mean, you hear about it on the news or whatever, and you don't expect it to happen to you. But it just seemed a long time, considering the midwife was upset about or concerned about the heart rate of the baby. I don't know what was wrong there.
Of course.
With the heart rate.
Yeah. And may I ask how the baby at the moment is? The baby
as I said, it's in special care unit. It was on a ventilator. It's come off the ventilator because he was quite poorly. He's making good progress now.
Okay.
So hopefully he'll be able to leave the unit and we'll be able to go home. Obviously, I've had a cesarean as well, so we're both in the wars,
Yeah, and how do you recover with everything, do you think?
Well, I'm a bit tired from it all, obviously.
Yeah.
I can understand that, and I'm a bit sort of stressed about it and a bit worried about him. But they've assured me that he's on the mend, so I don't know if there's any long-lasting effects. I don't know.
Sure, I'm sure that the baby doctors they're developing a plan of care for the baby to check that the baby actually recovering well, and then whether there is any long-term effect or anything later on. Okay, so is there anything else during your labor and delivery that you would like me to address? Or
no, I think the main thing was the time.
Yeah.
The big baby, and then the measurements, and then the glucose, and then, like you said, that's the main things really, and obviously, the future.
Yeah, of course.
I don't want this to happen again. I don't want to move house to go and have a baby in a different hospital. I would, you're saying that in the future, if I had a baby again, it'd be best to have it. I'll have to have it in a hospital.
I would say yes, because obviously you had this scar from the cesarean. Obviously, then I would advise you just to give a good gap, before you try to conceive again, because obviously those scar needs to heal first. Okay, so I would advise you to use a very good contraception. Okay, do you plan to breastfeed the baby at all?
Well, I've been using a pump,
Okay,
up
that's
till
really
now,
good.
so,
That's really good. Yeah, then obviously we can discuss sort of what is the best contraception for you if you want to breastfeed the baby. Okay, and then afterwards, after a year or so, when all the scar heals, then you may start to actively try to conceive again.
Well, that's good to know.
Yeah,
okay,
and
appreciate that.
And obviously, what we'll do, we'll have like shared care with the consultant in the hospital as well with your next pregnancy. Partly because you have now the scar from the section, and partly because we want to monitor the growth of the baby as well. Okay.
So do you think I'd probably have like extra scans? Is that what you mean?
So basically, if everything looks normal, we don't normally offer the extra scan. Okay, but then if you develop the diabetes in pregnancy, then you will definitely have the extra scan. Okay,
well, that's good
again,
to know.
if the measurement looks big, then it's probably worth to just do a growth scan for the baby as well. So it's fairly dependent on how is the next pregnancy going, really. Okay, right. And then obviously I know it's just 3 days after your cesarean. There are so much things happening. It's probably, it's not easy for you to take in everything. We're going to invite you to come back to our postnatal clinic appointment, so that we can go through everything again with you. Or if when you're going home and then you've got some more other questions, then we can discuss and go through everything again.
So have another appointment then?
Yes, we will invite you to to postnatal clinic appointment afterwards. Is that okay?
Then. Yeah, then hopefully he'll be at home and everything will be all right. Moved on. Okay.
Is there anything else that you want me to?
No, that'll do for now. I think I've got. I feel a bit better, but obviously, you said you're going to do your own sort of investigations as to why it took so long and why the midwife didn't pick up. I'd like feedback on that next time we meet. Yes,
and hopefully, by the time we meet you in the clinic, hopefully we will have this sort of report and summary so that we can, share it with you as well. If that's okay.
All right. Thank you, Doctor.
Thank you.